So I did one co-op experience at my time at Northeastern. I worked at Beth Israel. I was a clinical practice assistant and a phlebotomist. And what that meant was my day-to-day looked like vitals, stocking medical carts. I worked primarily with nurses, and we made the doctor's experience much smoother. So I did a lot of intake as well. When we brought patients in, we checked their height, their weight, their vital signs, we drew their labs. I should mention that I worked in the oncology unit. So in oncology, patients' labs are drawn every about 5 to 6 hours. So that was a big part of my job. But a lot of Bouvé co-ops look very similar. We all take vital signs. We all learn how to stock medical carts. We become familiar with medical terminology. But the one special thing I think about my unit is that we worked with a very difficult patient population, being that most of these patients have cancer. But this was an outpatient clinic, so these patients would come in approximately maybe 3 to 5 times a week, and we would see them very often, so you build relationships with these patients, which is really interesting because when you get to know someone who is very sick and you get to see them very often, you care for them. You see them as a person, you get to know their life stories. How many kids do they have? Where have they lived before? What did they work as? Are they retiring now? You get to know a lot about them, which I think is incredibly rewarding. That was a little bit about my co-op experience and what I did, but the takeaways I think are limitless. They're much greater than what I did. I think that personally, these experiences have very much informed my view of healthcare, and it's a big part of why I succeeded and why I will be attending medical school.